Hi, everyone, and welcome to today's Q&A session on the AOPA Affinity Health Plan. My name is Joy Burwell. I'm the Director of Communications and Membership here at AOPA, and I'm joined by Terry Gorman and Todd Mayle, who are going to walk us through a brief presentation on the plan, and then the majority of the time will be spent on answering your questions. So after they get through the presentation, if you have a question, drop it into the questions box, and we will then pose it and get those answered. And this is being recorded, so you will get a recording of it after. So with that, I will turn it over to Terry and Todd.
Thanks very much, Joy. Really appreciate it, and welcome everybody. Very happy to be here, and very excited to tell you all about this incredible program and the benefit that AOPA is making available to you by sponsoring this plan. And real quick before we move to the first slide, and as Joy said, this is going to be a quick presentation because we're actually more interested in answering your questions than we are in droning on and on. But by making this program available to you, what AOPA is doing is they're giving you access to a large company style health benefit program designed for the small and mid-sized market, and for most of the members, most of the people on this call, deep discount to what you're paying right now. So if we could jump to that first slide, Joy, we'll kind of get into how the program works. This plan looks, smells, feels exactly like your traditional small group insured program. The difference is that for most of you, there's going to be a significant savings. In fact, for many, up to 35%. But just like you have right now, assuming you're sponsoring some kind of group plan, you're going to have your level monthly payment. Once you get set up and once you're put into the program, and we have rate tiers, which we'll go into in a little while, once you get assigned a rate tier, those monthly premiums, those rates, those are your rates for the full year. Program goes effective on January 1. It doesn't renew until January 1 of 2023. But your rates are set for the full year. So all you have to do is pay the monthly payment, and we take care of the rest. We're going to manage the program, and we're going to continue to bring you the savings and the high quality benefits that you want to see. Nothing can change your monthly rates during the course of the year. The only thing that could change your monthly premium during the course of the year would be if you hired a new employee or an existing employee left. Then you'd see your premium change, but your monthly rates are going to stay exactly the same. We can go on to the next slide, and we can talk about all the incredible benefits that this program provides. So we recognize that there is no one size fits all with this. So with this program, you actually have 14 different plan design options to choose from. There are going to be 7 preferred provider organization plan designs, and there are going to be 7 reference-based pricing plan designs. PPOs and RBP are very similar, the difference being when a person goes to the hospital for an inpatient, in-facility treatment or procedure, that's where reference-based pricing is actually going to see some price advantages because of the way they negotiate reimbursement levels for that. So, but you have a total of 14 different design options. Deductibles as low as $1,000 with copays of as low as $20 to see your primary care physician. We have, depending on the plan design options, we have co-insurance options for in-facility or X-ray and lab type work of either 100% or 80%. There are HSA and HRA options available. With this program, you have access to 2 different very large national networks. Very important that you understand that they're national networks and not just regional. With both of these programs, you can take it anywhere in the country. Why is that important? Well, what if you have a child that decides to go to college, 7 states away? The program is still going to work for that child wherever he or she may be, and not limited to the geographic area where you and your company is located. A very unique benefit that we have that's pretty standard in the large case market, but hard to find in the small and mid-sized group market, and that's my favorite program, is the medical concierge and advocacy service. This is a service that's available to you where you can use it for a variety of reasons. The simplest one is you look on the plan and you find out your allergist is not in network, and boy, you'd really rather not change that doctor. You'd really like to get them in network. Well, reach out to the Medical Concierge and Advocacy Service, or Todd and I, and we'll do it on your behalf. And they will try to recruit that physician into your network. And in 98% of the cases, when a physician is identified as being outside of network and a member would like to get that physician in network, 98% of the time we're either able to get that physician into the network, or we're able to come to an arrangement with that physician for you to be treated as if they are in network. We call it a single case arrangement, and they're very happy to do that in 98% of the cases. Other thing, even more important, that the Medical Concierge and Advocacy Service does, in my opinion, is you get that very complicated diagnosis. You don't really know where to turn. You don't know what's the best treat. There's 5 different treatment options. What's going to be the best one for you? You can reach out to that Medical Concierge Advocacy Service. They can take a look at whatever your report is, and they can walk you through the process and say, well, okay, this level of treatment has a survival and a recovery rate of X versus this level versus that level, and help you get to the decision of what type of treatment you'd like to pursue. And then the next step is they'll also be able to tell you who is the best doctor in your area that provides that level of treatment, who has the best recovery rates, the lowest readmittance rates, the lowest infection rates. All of that information is out there, but it's not readily accessible to the individuals. You don't need to have it readily accessible to you, because your advocacy service has it for you, and they can help walk you through the process. And once you make that decision and choose where you want to go, they'll even set up the appointment on your behalf and then follow you through the entire process. We have teledoc services with this program, 24/7, 365, with 0 out-of-pocket costs to the member. And then, of course, all the preventative care options within the program align with the Affordable Care Act requirements. We handle COBRA administration for any organizations that are subject to COBRA, and there's a lot of other bells and whistles that go with this program, and Todd and I will be happy to get into details with you on one-on-one. Don't want to take up all of our time here with that. And with that, let's kind of move on to the next slide. Again, and this just kind of reiterates what I said. Very simple. You get one predictable monthly payment. We handle plan administration, plan management, and you get the quality benefits. You have several levels of customer service. Certainly there's that number on the back of the card for your members, but if you as the employer are incurring some issues and so forth, you also have Todd and I to help you through the process all the way. Now we get to an important slide, how to enroll slide. An enrollment is a multi-step process, okay? We've set the rate tiers. You guys, we reached out to you guys. We asked you to provide us with some census information. By doing that, we were able to set rate tiers. Now we need to find out which tier your particular group will end up being in. And so that will help you and us decide whether or not there's savings in this program for you. Like I said, for the vast majority of you, there's going to be some level of savings. To find out whether or not there's savings, what we need you to do, and this is the important part, we need you to have each one of your employees complete a personal health questionnaire. It takes them about 5 to 10 minutes through a HIPAA certified secure web portal that's set up specifically for AOPA members. It takes your employees about 5 to 10 minutes to answer this personal health questionnaire. Once we have all of your particular employees completed the personal health questionnaire for themselves and family members, it'll take us about 2 to 3 days to come back to you and say, okay, you're going to be in tier 1, or you're going to be in tier 3, and here are the rates for the various design options in that tier. And at that point in time, you decide whether or not you wish to proceed. Very important for you to understand and for your employees to understand, because it can be a little overwhelming and disconcerting to have to complete a questionnaire like this. Nobody at AOPA is going to see the information that's in that personal health questionnaire. Nobody at your particular company is going to see that information. Todd and I aren't even going to see that information that's in that personal health questionnaire. That information goes directly to the underwriters who are determining which tier you're going to end up on with. So we don't get to see that. You don't get to see that. AOPA doesn't get to see that. It's important that your employees understand that. Once you're set up in a rate tier, Todd or I will come back to you and let you know what's the tier, and assuming that there's savings there, and there's going to be in most cases, then you decide which is the plan or the plans that make the most sense for you and your employees. The plan is initially going live. The AOPA plan is going live on January 1st of 2022. We're getting close. But if for whatever reason your program isn't renewing on January 1st, or you're not ready to make the move on January 1st, you can come in the first of any month. And all we need to do is have all of your paperwork in by the 15th of the previous month, and you can go live on the 1st of any month. With that, let's go to kind of a snapshot of the various rate tiers that are out there. So you can see there's a lot of them. And like I said, we have both the reference-based pricing and the PPO option. The richest plan that we have available, that's a low deductible, low copays, has a single rate of $567 in tier 1. The PPO rich plan has a single rate of $685 in tier 1. Obviously, the rates go up as the tiers get higher. So it's important my guess is that for most people that are on this call, if they look at these rates, they'll see, hey, there's some pretty significant savings in the first 3 or 4 tiers. So that's why we need to have you guys complete these PHQs so we can figure out where exactly you fit, so that you can make the right decision for you and your organization and the employees in your organization. And then with that, we can click on to the last slide, and then we'll start taking questions. So by sponsoring this program, what AOPA is doing is they're giving you, each of you small and mid-sized employers, they're giving you the ability to gain some control over your healthcare expenses, because I recognize in this market today, it seems sometimes like it's out of control in the small group. It's hard for you guys as a business owner to budget what you're going to charge your clients in the upcoming year if you don't know what your rate renewal is going to be for the health insurance that you provide to your employees. Is this the year we're at 5 or 6%, or is this the year that we're at 15 or 16, or God forbid up above 20%? And it's happened. So what we see are much flatter renewals going forward because of our risk management strategies that are in place, because of all the ways that we're able to source medicine that different than standard small group program, and also because we've spread the risk out amongst many employees. So an excellent program gives you access to expertise, gives you access to significant support and quick resolution of issues, and also allows for much flatter and more predictable rate increases year over year, which allows you to budget better for your business. And with that, I'll stop talking, and we can start taking a look at the questions and answer them as we go.
Great. So yeah, we do have a couple of questions that have already come in. And so as a reminder, you can submit your questions into the question panel. Also, wanted to note, and I should have done this at the top, there are 2 handouts in the handout section. There's the slides from this presentation, and then the FAQ sheet, which is also available on the AOPA website, but wanted to make sure you could access both those here. But I will start with the first question, which is, what networks are you using?
Okay, so we have 2. With the PPO, we have a network that's called First Health. It's a fully owned subsidiary of Aetna. Just real quick, and to bore you guys a little bit, Aetna owns the largest third-party administrator in the country. They're called Meritain. Meritain's deal with Aetna is that only they can use the Aetna name in an independent managed program like we have here. So Aetna acquired the First Health Network, and that network, for all intents and purposes, mirrors Aetna's national PPO network. The network that we have with the reference-based pricing option is the PHCS network. This is a network that's well known in the large employer self-insured space, but probably not as well known in the small group employer marketplace. But PHCS has over 700,000 physicians in their network nationwide, and they actually have some of the highest reimbursement rates for physicians out of all the various carriers out there. With the RBP option, there is not a hospital network. Your members can go to any hospital in the country. With First Health Aetna network, there's obviously it's a physician network as well as a hospital network, and you need to use. There are out-of-network benefits available in this program, but for the highest reimbursement rates, you want to use an in-network facility. Hope that answers the question.
Okay, the next question we have that came in is, are you able to offer multiple plans for the employees to select from?
Absolutely. In fact, most of our members do just that. They'll offer anywhere from 2 to 4 different programs. They'll base the contribution that they're making on behalf of the employee to a plan and say, okay, the base plan is going to be the $3,500 plan, $3,500 deductible plan with a $30 copay to go see a physician, and we're going to contribute X towards the cost of the single benefit there. If you want to buy into a richer plan, perhaps up to the $1,500 plan or the $1,000 deductible plan, they give their employees the option to do just that, and any additional cost for that are borne by the employee on a pre-tax basis through payroll deductions.
Okay, another question regarding employees. Are all employees the same rate, or does it change based on their age?
We do not have age-banded rates. So all your single employees, depending on what tier you end up in, all your single employees would have the same rate. All the employees that are choosing husband-wife coverage would have the same rate, parent, child, or children, and family, et cetera. So no, it doesn't change with age banding.
And then how many family members can be on the family plan?
How many have you got? There is not a limitation. We have the parent and child or children rate is the same rate if it's just an individual and 1 child as it is if it's an individual and 7 children. And if your family is a family of 3, husband, wife, and 1 child, it's the same rate as husband, wife, and 8 children. God bless you if you have 8 children now.
Okay, here's a specific question. For our group practice, about 6 to 7 employees would participate. Would the rates be given individually, or is a group rate with the same employee being the same price?
So the tier setting is by employer. So each employee, the group, your particular organization is going to be put into a tier. All the employees' rates are going to be the same. So every single employee in your organization would have the same rate, et cetera.
This might need some clarification from the questionnaire, but they asked, how do we find out who is NW? Does that mean anything to you all?
NW.
NW.
Todd, I don't know what NW stands for.
Oh, in network. In network.
Oh, in network. Okay.
Oh, sure. So we have links to both the First Health Network as well as the PHCS network. If we don't have them on the AOPA website, we can get them up on the AOPA website, and of course, Todd can send them to each of you as well. We've been having calls with a number of you that have reached out to us, or we've been reaching out to organizations, and then we're following up those calls by sending you guys links to the networks and then all the information on the program as well.
Question, I filled out the medical questionnaire. When will I be informed what tier I am in?
So reach out to either Todd or I, whichever one of you have discussed this with you. And if you're in there and if you're the only employee that's gonna fill out the questionnaire and be the only employee on the plan, let us know that, and we'll find out your tier right away. And if you will. We don't like to set a group into their tier until we know that all the employees have completed the personal health questionnaire. So reach out to us. We know who's completed the questionnaire at this point in time. We get these reports twice a week. So reach out to us and we'll let you know. Once we know that we have all the employees in your organization have completed the questionnaire, it takes us about 2-3 days at the most to determine what tier you're going to be in.
Right. And I'm going to interject there too, Tara, real quick. There are a few folks who I've talked to over the course of the last couple of days and even right at the holiday. We did recently submit more folks into that review portion. So we were notified by people in the last day or so that they were done in the last couple of days. So we anticipate having that information back to you folks as soon as possible, as Terry had said. But if I had already spoken to you, you are now in that review portion.
Great, and we had a question that's related about where's the link for this questionnaire. So the link for the questionnaire can be found on AOPA's website. If you go to AOPA.net.org and then under member benefits, there's a web page called AOPA Affinity Health Plan. You'll see, once you're on that page, you'll see that link and all the other information as well as contact information for Todd here. So next question is, will you be able to accommodate Medicare as a secondary payer?
That's a good question. And we'll have to get back to you on that one. Whoever is asking that question, please reach out because we've been able to do it with some groups, but not others. So whoever's asking that quick question, please reach out directly to Todd or I, and we will get you that answer. And once we find that answer, you know, that would be a good one to add to the FAQs, Joy. So we'll get that answer and then we'll put it up there too, as well.
Great.
Yes, I hate when I get stumped.
Question asking, is life insurance available?
Not at this moment. With this program right now, we have the medical and we also have a dental and vision option that's available. At some point in the future, working with AOPA, we'd like to make life and disability and even voluntary benefits available to you, but we're not there yet.
Okay. Question of, do we have to enroll a certain percentage of employees?
You do not. So unlike the small group market where a certain percentage of your eligible population has to be enrolled, we do not have that requirement.
Okay. Can you make this program available to O&P clinicians not employed at present and not eligible under COBRA?
I'm not sure I'm following that question.
Yeah.
So this is a group plan. There has to be an employee-employer relationship. We do have clinicians that are sole proprietors that can get into the program, assuming they're AOPA members, but I'm not really otherwise sure of what you're asking.
Okay. Someone asked about who the dental coverage is through.
There is not a network. You can go to any dentist that you want. There's just a reimbursement schedule.
And then a follow-on to that, is the dental and vision included in the tier costs or is it an add-on?
It's an add-on.
Okay. And someone commented, I think when we were talking about disability, they were asking short-term and long-term, and I think if we pursued that, it would be both, my guess.
That's right. Yes.
Right. Mm-hmm.
And then question, which is a good question, will this program move forward regardless of number of companies that participate?
Yes, it will.
Okay. Specific question, is this through Delta Dental? I don't.
It is not Delta Dental, no.
Yeah.
All right, we did address all the questions that have come in. We'll give it a few more minutes. Again, and if people have additional questions, I would encourage you to first visit the AOPA website and look at that web page and the FAQs that are up there. And then if you have those questions, the contact information is on there that you can shoot those questions to. The dental is a popular question. So who provides the dental insurance?
Well, it's a self-insured administered program by performance. So there is no network at all. So we're providing it through the same third-party administrator that administers the medical program.
we probably should have included maybe those in the slides. We can do that, and we can get them out to you.
Okay,
Yeah.
that'd be great. Yep, and then we'll get this information out, posted on the website too, in case folks that weren't able to join today wanted to look at it.
Sure.
Absolutely. So I'll reiterate, if this is something that you're thinking may make sense for you, please get your employees to get on there and complete the PHQ. We can't get anybody in if they haven't completed a PHQ. And technically, we need all that information in and set by December 15th for anybody that wants to be live on January 1st. So that's a key part of this program.
Great. So a little around 2 weeks, less with just business days. So still time, but coming up close.
It is. Time
Indeed.
gets quicker and quicker this time of year.
It does. Okay, another question just came in. Is there a schedule for out-of-pocket max, etc.?
Yes, we have all of that information we can make available to you. We have the SBCs, summary benefit descriptions for each of the programs. So yes, we can make you aware of what the out-of-pocket max is for both individuals as well as full families. It varies by plan option.
I am not seeing any additional questions, and I know we have given some good information today. I really hope that everyone on this call feels free to reach out with additional questions, and or if they've had their questions answered, go in and fill out the appropriate questionnaire. AOPA is very excited to be able to offer this to our members. We're looking forward to getting your feedback throughout the year, so we can make improvements going forward in subsequent years. But again, we've been working with Todd and Terry and their team for well over a year, and are really excited to be able to bring this to the membership. We think it'll be a huge benefit, and it was something that was asked for in the 2019 member survey we did. So we're very pleased to be able to deliver on this. A place on the website. So under on the website, if you go under member, you'll see the drop down. If you hover over that on the website, you'll see the AOPA Health Affinity Plan. And I will send a follow-up email to everybody that was on this webinar with all the links and the slides and the recording, etc.
Perfect.
Thanks, Joy. You guys have been great.
Thanks everybody. Hope everyone has a good rest of their day.
Thank you, everybody.
I appreciate it.